Welcome everyone to today, the only one, a good one. Hope we can make it a great one. I was just sharing, I'm so glad to be back with you all. I was joining via phone call on the road last time, and 2 months ago, we welcomed a new life into our family, and so I was on leave. Yes, thank you so much. And so excited to be back to host and be a part of the Allen County Health Equity Coalition. So glad that you guys have joined with us online. We want to make sure that we are always being in the know and getting connected with one another. And so we want to make sure that we have these platforms for everybody to join in. And so we're so glad that you've joined us. And without further ado, before we get into any of today's discussions or anything else, we want to open up our time with a meditation. As we enter into our meditation this morning, I want to make a special note that we are introducing our newest coworker. Aaron Archer has joined our team as a community health worker. Wrong way. It's good. It's backwards. Our camera's backwards. And so Aaron Archer is here. And so he actually will be doing the opening meditation. So I will now turn the screen to him.
Yeah, you're good. I don't know if you guys can hear me very well or not. Can I get a thumbs up or something if you guys can hear me well? Okay. Oh, she said kind of. She said, okay. All right. See what hopefully. All right. What about now? Y'all hear me a little better? Perfect. So as Cassia said, my name is Aaron Archer. I am a new community health worker here. So today what I'm going to be doing is a quick meditation. We're going to be looking at a Bible story. I know everybody on here may not be believers, but, this is something, that you can still look at and learn and get something from. And then we're also going to do a grounding technique that I used to teach some of my kids back when I used to work with kids in a after school program. So we're going to be reading specifically out of Luke 10:38. And so we're reading something that, people call a narrative devotion or a dramatic reading. I'm not going to get into what it is, but you guys can look it up if you want to figure out more. And so just to give a little context, specifically in this story, what you're going to see is Jesus in his ministry. He's moving out, he's doing a lot of different things. And actually, he has what the young folks refer to as clout. He's very popular, he's very known right now. And so what ends up happening is he goes into this village and there's these two sisters and they decide to have him over for a dinner. And so this is where the story is going to start. And so I'm going to be reading this. So if you see me looking down, I'm reading the story. So it says, Jesus entered the village with his disciples, and he was welcomed into the home of a woman named Martha. Now you can imagine the scene. The house isn't quiet. There's movement, preparation, things to clean, food to cook, details to manage for the dinner that she's preparing. Martha is moving quickly, back and forth, hands full, mind even fuller. She's thinking about what's not done yet, what still needs her attention, what could go wrong if she doesn't handle it. And in another part of the house, her sister, Mary, is sitting at the feet of Jesus. She's still, she's listening, she's fully present, not worried about what's next, not pulled into a dozen directions, just there in the moment. Martha, she notices. At first, maybe it's just a glance, but then it lingers. And slowly, frustration begins to build. There's so much to do. Why am I doing this alone? Why isn't she helping me? The more she thinks about it, the heavier it feels until finally she can't hold it anymore. And she goes to Jesus and says, Lord, don't you care that my sister has left me to do the work by myself? Tell her to help me. You can hear it in her voice. She's overwhelmed, stretched thin, trying to keep everything together. And Jesus responds, not with correction, but with gentleness. Martha, you're worried and distracted by many things, but Only one thing is needed. Mary has chosen what is better, and it will not be taken away from her. And in that moment, everything slows down. Not because the responsibilities disappeared, but because something more important was being offered: presence, stillness, being fully there. And the truth is, we've all had these Martha moments, moments where life feels busy, loud, overwhelming, where our thoughts are racing ahead of us, where we can't figure out how to get the Zoom audio to work. But right now, what we're going to do is we're going to choose to practice what Mary chose, learning how to come back to the present moment. And so, what I want you to do is I want you all to just turn off your cameras, and I want you to take your attention away from the computer screen, which is why I'm asking to turn off the cameras. And I want you to draw your attention to the room that you're sitting in, whether that's in your office, whether you're at home. And don't look at me either. Focus on the room. And so, what we're going to do is I want you to start off by taking a deep breath. Breathe in, breathe out. We're going to start off by looking around the room and noticing 5 things that you can see. And I want you to look at the details. Maybe it's a coffee mug dripped on the side, the desk that you're at. Now I want you to look around and I want you to notice 4 things that you can feel. Maybe it's your feet on the ground, your hands on the mouse. Now I want you to notice 3 things that you can hear. Maybe it's in the room with you. Maybe it's outside. Then I want you to see if you can find 2 things to smell. And then finally, I want you to notice 1 emotion that you're feeling right now. No judgment, just awareness. All right, you guys can go ahead and turn your screens back on. Take a deep breath. So, oftentimes, and I'm getting ready to wrap it up. I'm sorry if I went over the time, but we look at this story for those of us that have heard it before, and we hear these 2 opposing figures: somebody that's rushing, getting all these things done, and somebody that, is pausing, is present. And oftentimes we look at it like this is good and this is bad. But I want to just bring your perspective to the fact that both are okay. Many of you know that are on this call, there's times when there's diligence, focus, hard work required for the things that we do every day. So it's not that either are right or wrong. It's about the time. And so when do we choose to focus, to be diligent, to work hard, and when do we choose to pause and step away from the work? Um, just like Martha in this moment, I'm sure she was overwhelmed. We are too sometimes. But I just want you all to remember with this quick meditation that we did, with this quick grounding technique, that we can always return to the moment, to our breath, to being present right here. So that's all I got for you today. So sorry again for the audio stuff. We should be good to go now. So, good over there.
All right. Well, thank you so much, Aaron. No, it's definitely needed. as he said, when life is going on and you have those quick moments, it's good to just pause. It's good to respect the pause. And in doing so, in this moment, I want us to take the time to hear who is on the call. So if everyone could come off mute and say hello, say what's going on, say who they are, what organization you represent. And if this is your first time, please let us know that as well.
I would like to introduce myself to some. Although most know me, I am Sharon Tubbs. I'm the executive director for Health Visions Midwest, and am really fortunate to be the leader of this team. And I wanted to say a little bit more about Aaron. Thank you so much, Aaron, for that meditation. Some of you have not met Aaron. Cassius gave him a little bit of an introduction. He is our new bilingual community health worker. Aaron comes to us from a varied experiences. He used to work with City Life, an organization that we all know very well here in Fort Wayne, but he also worked in the Miami area. And so we are just fortunate and very glad to have Aaron on our team. As you can see, he's a deep thinker, and he likes to get the team going. And so we just thank you so much, Aaron, for that meditation. We thank you for the work that we anticipate you doing. He's going to also be leading our employer wellness program, where we're going to be going to different companies and presenting wellness presentations and programs for employers and groups of employees, as well as our bilingual program for Spanish speakers. So please give Aaron a little welcome hand clap, everybody. Virtually, I see some hands clapping. Thank you, thank you, thank you. Okay, now everybody, introduce yourselves, as Cassius said, but much more quickly than I did.
Peggy Hayes, Health Vision.
My name's Tammy, and I'm from Indiana Donor Network / Donate Life Indiana.
Good morning, I'm Dick Hamman. I'm from Parkview Behavioral Health Institute, and I have my coworker here with me.
Hi, everybody. It's Heather Henry. I am with the SOS Mobile Crisis Team. Back in action.
Yay!
Heather!
Hi, I'm Diane Starks. I'm with Urban Beginners Choice Federal Credit Union. Good morning.
Good morning. This is Sandra Thomas from Cancer Services.
Yay!
Good morning, Pat Turner from Tobacco Free Allen County.
Cassandra Rosine, Stillwater Hospice.
Good morning, this is Esther with the United Health.
Good morning, this is Diana Jackson Davis with Parkview Health Language Services. Hi, Heather. Hi, Dick.
Good morning, Irene Paxia. Happy to be here again with the Language Access Lab.
Melissa Martinez from the Allen County Public Library.
Good morning, this is Zeke Gidado from the Center for Nonviolence.
Matt Smith from St. Joe Community Health Foundation.
And Jackie Martinez with the St. Joe Community Foundation.
Laurie Weinzapper, United Healthcare Medicaid.
Elka Jackson, Center for Nonviolence.
Good morning. Autumn Trice checking in from Bright Point.
Yeah. Well, Cassius is muted. I wonder if is there anyone else who hasn't introduced themselves?
I'm Nia Hinton, Community Health Specialist, IU Health.
Yeah.
There's a gentleman over at Neighborhood Health. I didn't hear from him quite yet. He must have stepped away. He's normally on camera. Mr. Carlos Glofton. There
Did
he
you not
is.
hear me? Oh, my bad. I think it like, I don't know, kicked me off for some reason, but Cassius is right. My brother Cassius, I'm glad to see you back. And he is correct. I am in fact the one Carlos from Neighborhood Health. Good to see everybody.
Hey, Carlos.
All right, all right. Well, thank you everyone for introducing yourselves, and thank you again for being here. We again love this space to connect with one another, but to also hear from the community and organizations. And so I want to introduce our speaker for today. I actually, getting back into my role, one of the things I love to do is get over to the Tall Rabbit. And so I saw this gentleman over at the Tall Rabbit, and he was sharing with me what he had going on. And this was brand new to me. This was brand new to me. And so often when I hear something new, I'm like, okay, if I didn't know about it, maybe a lot of people didn't know about it, because again, I'm in grade and I'm trying to hear everything that's going on. And so I want to take the moment to introduce our representative, our presenter today from Parkview Behavioral, Dick Hamman, and I think he has Heather Henry with him.
Yeah.
Dick, you are welcome to share your screen.
Okay.
And you can go ahead
Maybe
with your
technical person.
presentation. We are excited to hear all the phenomenal services and everything you guys are doing. And everyone, please be patient with us. I don't know what's going on, because I see a lot of people keep getting kicked off and joining again. So we appreciate y'all. All of this is recorded, so if there's ever a lapse and you miss anything, we'll get that recorded to you.
Do this.
Yep, shrink that down.
This one.
And then find your file.
One moment here. We're pulling up the files. Okay. Well, good morning, and thank you for allowing me and Heather. I just happened to be hoteling over here at Heather's office, and I said, "Hey, I'm gonna speak this morning. Would you like to join me?" And she said yes. So anyway, some of you know, some of you I know, some of you I don't know. But anyway, thank you again, Cassius, for inviting me to speak for a few minutes. So I'm the business development manager for PBHI. So I travel the 12 or 13 counties that we provide services to, which includes our community hospitals, ERs, etc. And when I was explaining a few of the things that were going on, he then asked if I would speak, and I said absolutely. So I want to show and share just a few of the things that are going on. And one of the things that is the newest, which I love, is our I call it our roadmap of services. And this sheet of paper is amazing. It has great information. On the front, it actually shows where we provide behavioral health services in Northeast Indiana. And then on the back side, it has the addresses. And then on the back side, it actually shows what services we provide at each of these locations. So I wanted to share this with you. I have emailed my slides here, or this information, to Cassius. And if any of you want any of this, I'm happy to, email it. I'm also happy to drop it off in person. I have, a lot of this information, a lot of copies of these to share, but this is really good. And I've had really good feedback on this. That basically just shows where we provide services for behavioral health in Northeast Indiana. Any questions about this piece? How do I get to the next?
Dick,
Yes.
I have a quick question. When you're talking about behavioral health, can you tell us just kind of generally what that encompasses?
So when we talk about, behavioral health, our services include services for those individuals who are having a mental health crisis. And Heather's going to talk a little bit about that when we get to the SOS screen. And then we also have inpatient services for those patients that need inpatient services, whether they're going through a mental health crisis, whether they're having, and you can chime in anytime, whether they're having addictions with drugs, alcohol, etc. issues, we are able to help with any of those issues. Does that help?
Yes, yes.
Uh-huh. So our inpatient hospital currently is located on Beacon Street. It's the old Charter Beacon Hospital. And at that particular location, that's our inpatient hospital. We have a youth unit there. We start at age 5 and we go up to adults. We are seeing more and more youth in the ages 5 to 11, which breaks my heart, but it is real and it's happening. And so I do visit all the school districts in the counties, and I now have to incorporate the elementary schools because those folks they're just really in need for services. Both law enforcement and school districts want to know 2 things. When I visit them, they say, Dick, tell me what to do if and when we have a person in crisis, and how does it work? That's all they want to know. So I have worked really hard with the school districts and also law enforcement, educating them on how we can be of assistance to them if and when they want to call us. That kind of leads me to the next slide, and let's go to the PES. Yeah, PES. So because of what I just said about those that are in need, last summer I began to market and talk about our 24/7 direct admission line. This has been working very, very well. School districts, law enforcement, city police, EMS, you name it, have this information, or hopefully they have this information. And if they if they encounter an individual who is in a serious, true crisis situation, they can call our Psych Emergency Services number, which is this. We shorten it for PES, P-E-S. They are our admissions team located at Randalia Hospital. They sit adjacent to the ER, and when they get a call, they are helping individuals, whether it's law enforcement, school district, a parent, the individual themselves can call. And they are trying to determine what does this person need and what are the best next steps. And so we are doing virtual assessments for behavioral health now in all of our community hospitals. So whether it's Wabash, Huntington, Noble, LaGrange, an individual can go to any of our ERs, and this department will be called to do a virtual assessment. And that's also been working extremely well. So again, this number goes to our Psych Emergency Services team, and they are available 24/7, and they're going to direct what the next steps are. Heather can talk about this team. We also have the helpline as well. And so they can call. What we've been trying to do is streamline, and so individuals don't have all these numbers that they have to remember and who do I call for what. But this department is also very tightly connected to Heather and her department. And I'm going to ask Heather then, the next slide will roll right into her team and the mobile crisis unit and how they are alerted and what they can do to assist the individual.
I can click. Sorry, guys. Alrighty, so this is kind of an example of our panel card for the mobile team. And we are 24/7. We're located right off of the Randalia campus. And what we do is someone is in crisis. We try to have folks call the helpline, which is 471-9440. The helpline associate then will ask some questions. A lot of times, some of the first questions they'll ask is, can I confirm the phone number where you're calling from? And what is the address you're calling from? And that is very important because we may have times where a person maybe is having a mental health crisis at the library. And it's important to know where that person is at when, if the team gets sent out, because what happens is technology, as great as it is, there are moments where we have magnetic storms and all kinds of good things where phones still drop. And we don't want to have a person in crisis and we have their home address, but they're at the library. So us going to the home address isn't going to help them, where we can actually go to where they're at. So that is what about what the helpline does initially. Then they'll do a warm handoff to the mobile crisis team. My team will just talk to the individual, find out what's happening, what their crisis currently is. We respond to both mental health and substance use disorder issues. At that time, our primary goal and focus with the mobile crisis team is to keep people in the community, to help them maintain in the community. And if they're not connected to services, connect them to services. If they are connected to services, we're going to help them to reach out to their provider to get in and be seen because they're in a crisis for whatever reason. From there, we also do counseling on access to lethal means. The calm training. So what we want to do is we want to make sure that that person is safe because we know, and research has shown, if we can put a pause when that person is considering suicide, that pause can be the difference between suiciding or being here today. So we always want to work on that counseling for access to lethal means, as well as safety planning with them. There are times we will reach it after we're done kind of seeing that individual. We then staff our cases with the licensed therapist in PES and make sure that we've got a good plan in place by our licensed therapist or advanced practice provider, whichever one we staff with. We all make sure we're on the same page for what we can do to keep this person safe and keep them healthy and alive, making sure that they're connected to the services they need and de-escalating that crisis. We do go to 11 counties in Northeast Indiana. It's basically from Adams County up to the state line and then LaGrange County down to Wells County. And I'm like trying to think of what I want to say here. We respond as soon as we possibly can. We go out, we're always in teams of 2. And we just want to make sure that people are safe. So that is the most important thing. When it's necessary, we will take that person if we're out, as Dick had said before, like if we're in Wabash County, we will take them to Wabash Hospital for that assessment with PES for next level of care before we would bring them here to Randalia, because there's nothing worse than maybe getting to Randalia and then not getting admitted. And then how are they going to get home? Because they came with us. So we always want to make sure we take them to the nearest Parkview Hospital where they can be further assessed if they do need that next level of care. We then follow up with that person within 14 days, make sure they're making those connections, making the appointments. One nice thing with my team is we do get priority slots for the assessment center to make sure that they can get a diagnostic evaluation if they're not already connected to services. So that's kind of nice. It's an in, and that will allow them to get into services like IOP and case management and what they need to be able to, be their best self. That's our priority, truly. So I think that's it about SOS.
Any questions for Heather? Okay, I have just a few more. Can you pull up? I just have 2 more screens and then I'll be finished. I know we're running over. Let's do the this IOP direct. Yeah. So I want to talk real briefly about IOP. IOP is our Intensive Outpatient Programming. We offer this at both Park Center and at PBH at the inpatient hospital on Beacon Street. And right now, we're focusing on the inpatient program at Beacon Street. We have current openings, immediate openings. IOP is an alternative that we a lot of times will refer patients to when they don't meet criteria for inpatient. And so, again, we're trying to streamline. Parkview's huge. There's multiple phone numbers. So, again, this is part of our streamlining strategy that individuals now, as you can see, there's no referral needed. You can call us now directly and get set up for an assessment. And again, this is specifically for the Beacon Street location. We'll also fill out FMLA paperwork if the individual needs that for work. So it's a 3-hour session, 3 days a week, and it runs for about 6 weeks, I believe. Leah Hall is our manager there, and they just do a wonderful job. And then next, I wanted to show you, I included the on the next, go to the next slide. You got to go back to that one. This just tells you a little bit more about the program. It answers some questions, but this is a really good sheet to look back on and to look at if you think that you might know somebody that would benefit from this group therapy. One thing I forgot to mention is that our Beacon Street location towards the end of this year is going to be moved. Well, that's going to be closing. And then we are moving over to Randalia Hospital on floors 3 and 7. We're very excited about that. It's a very, very huge undertaking that Parkview has decided to do. And I'm very thrilled that we are now going to have the behavioral health services under the medical roof and be all together, because it's just going to be an amazing service now for individuals who need this. There will be a separate entrance for the PBH area. We are trying to alleviate some of the confusion and the overflow and the busyness of the Randalia ER. That department is busy 24/7, and a lot of times these individuals with these diagnoses don't need to go to the ER, and so that's another thing that we're working on as well. Questions about the IOP? Okay, lastly, I see Colleen here, so I'm going to let Colleen talk about this, but I want to explain why I always include this in my, where I go and what I do. Colleen's, and Colleen, you can talk about this, but there is a booklet, a toolkit that goes along with this. This is the most comprehensive, most amazing 2-page front and back, listing of resources that is anybody needs. I mean, everything is right here, and it's just amazing. I was at an event yesterday. I take these with copies of these, and I also take the actual suicide toolkits, and I always run out, and I ran out again yesterday. So, Colleen, anything else you want to say about this? But I really, this is just amazing.
Thank you. I actually just made a PowerPoint presentation about this document to help unpack all the rich information that's in here. But essentially, many of you may know this, but the nation has their goal is to roll out, and that's what they're working on, that's what we're working on, a crisis continuum, so that we avoid calling law enforcement in a mental health crisis, and that we avoid using costly services like the ER or going straight to Parkview Behavioral Health or Maple Heights. So as you can see, there's 3 kind of icons. Someone to contact is 988 on the left, and we've been talking about that as a community for a while, but there's other hotlines too. And if that's not enough, there is what Dick and Heather just went over, someone to respond, which are mobile crisis teams. And actually 988, if you call or chat or text them to talk about your mental health crisis, will connect you to, if needed, a mobile crisis team, which is in the middle, that's someone to respond. And then if that's not enough, and or Heather's team, the mobile crisis team, thinks it would be helpful, that the third part of the crisis continuum is on the right, a safe place for help. And so that is like a walk-in crisis center. It's about, they call it 23-hour care. So if you don't think that you really meet the criteria to go to an inpatient facility, but you still need a place to sort of dial things down, de-escalate, maybe connect with a provider because there is a prescriber on site. Maybe you're having panic attacks and you just changed medication or started a new medication or ran out of a medication, and that's why you're really highly anxious. That's a place that you could get help to find a calm setting to de-escalate, but also to connect to a provider. And there's peer support there. So people just like us who've had our own mental health struggles, who feel a lot less threatening and really easy to talk to because they've had their own lived experience. So they're also there at what they call crisis receiving center or crisis receiving unit. Parkview's isn't quite open to the public yet, but they're using it internally. So Heather's team sometimes take people that they work with on the mobile crisis team, they'll transport them sometimes to Parkview's internal crisis stabilization unit because they're within Parkview's care, they can do that. But sometime soon, I always say June, but Heather, correct me if I'm wrong, there'll be, the public can walk in and get help.
I am hopeful that they'll be able to just come to the door and be welcomed to there. For right now, they can, if providers can refer, as well as the emergency department, my mobile crisis team will go ahead and we can all get people in, as well as the PBHI Park Center. Our PPG docs, our walk-in clinics, they've already called and said, hey, we have somebody. So it's just, we're still kind of working the bugs out so that it's a smooth process for everybody when we do open our doors to the public.
Thank you. And if you still want that walk-in experience, like right now, and Parkview isn't open to the public yet, the first one listed there is called NEC Cares, and that's Northeastern Center. It's up in Auburn. It's a little bit of a drive, but if you have someone that just really needs a place to de-escalate and figure out what's going on and you need help, you can walk into Northeastern Center's NEC Cares, open 24/7. They'll even help you with food, clothing, other needs that are creating your stress and creating your crisis. So, and Bowen's is over in Pearston, which is a little bit of a ways, but soon we'll have Parkview. So,
yes, and we do have showers, washer and dryer. So, if the individual in crisis has, they're homeless, a lot of times we'll have homeless folks, and they've not had a good shower or been able to wash their clothes. This is an opportunity. We have washer and dryer, and they're able to wash their clothes while they're here for 23 hours.
And Jamie H. remind us, Bowen has, theirs in Pearson, but every single Bowen location has a crisis stabilization room where you can come find some peace and some space, and a provider will help you, right? I'm assuming, Jamie, that's how it works.
Thank you, Colleen. I appreciate you jumping in there. But this is just, it's just amazing information. So that's what I had. And I want to thank Heather for hopping in here last minute with me, and Cassius, your invitation. And again, any of this information, please reach out to me. I'm happy to drop off additional information, whatever you need. I'm happy to provide it.
All right. Well, thank you so much, Dick, Heather, and Colleen for jumping in there as well. I will be sure to send over all the documents that you sent to me as we wrap up this, when we wrap up this meeting in the email. But I want to be mindful of our time. But if there's any pressing questions that anybody wanted to ask, we just had one or two. If anyone had any other questions, if not, Dick's email would be included in that response, and you guys can always reach out to him directly. Going once.
I do have a question. This is Kyle Lunford.
Kyle.
So from a perspective of not necessarily being in the healthcare space, what does it look like to have that information readily available for somewhere like a Ruoff Mortgage or for like banks or for even the gas stations in the area where a mental health crisis, like you can't necessarily identify when it's going to happen, but making
Exactly.
sure that we have something in place to where when it does.
Absolutely. I am available, and I'm very happy to supply information to any company or facility, that wants it. Sometimes it's through HR, sometimes they have it's called EAP, Employee Assistance Program. But absolutely, I'm happy to provide this information to any of those places. I do work with companies, General Motors, Vera Bradley, Water Furnace. I've got two more coming up, and they're new companies, but these are just connections that have just happened, and so did I answer your question? So if any of
Yes, you
those,
did.
if any of you have connections at any of those places, please have them reach out. Uh, uh, Cassius, you're going to send my information, so they'll have my contact information, correct?
Yes.
Okay. But I'm happy to do that. That's a great question. Thank you.
All
And we do
right.
have those mobile crisis panel cards. You want them somewhere, just reach out to us and we'll make sure you get them.
Yes.
I'll send a team out with them. If they're in that area, they'll just bring them. Otherwise, sometimes I do as well.
Hey, awesome,
Thanks.
awesome. Well, thank you all again for sharing out. And yes, in the wrap-up email, I will be sure to share contact information if there's any more questions that you all may have. As we look forward, I did send out the agenda in this morning's email. And so our next item is just talking about our health fair. So our annual health fair will be June 27th, 11 to 2 p.m. back at Fellowship Missionary Church. In that same email is the link to go ahead and register for the event. HEC members, there is no fee. Outside members, there's $35 vendor fee. We hope to include all of you again this year. Lots of you were there last year. Phenomenal event. We love putting it on, and so we're excited to bring it to the community again. Look forward to hearing from you all. If you have any questions about that, please reach out. Also, yes, June 27th coming. Also, memberships. So memberships are due. Memberships are due. So continue to pay those dues. Continue just to let us know that you're wanting to be a part of the coalition, and we will, work accordingly for you to join us. For next, I'll talk about that in just a sec. And then there's also a survey that was included in some emails, wanting to just hear feedback from you all. We love being in the know on what everyone wants to know about. As we get ready to plan these meetings, we want to hear from you all. What else should we be including? When we have our in-person meetings, what else are you guys looking to see? Is it like, oh, well, I went the last time and the food was okay. I'm looking for some food in this direction, or I have these dietary needs. So please let us know. I'll send that survey again in this wrap-up email. And then before I turn to the team to see if there's any updates to them and you all, I want to make special note of April 22nd's meeting. So April 22nd is our next Allen County Health Equity Coalition meeting. However, it will not be our traditional meeting in any sense. So it's not even just a regular what we've been doing with the in-person. It will be our rebrand open house. So it will be extended to the community, to you all, to everyone. So please put that on your calendar to join us. The time will be posted soon, so we just have that time frame on exactly when we'll have some problematic things. But then in that same space and during that day, please stop by because you will see the new brand and who we are going forward. We're super excited for that. Our team has been working diligently to just work towards, continue to bring impact to the community. And so that date for the open house is April 22nd, Autumn, if that's what your question is. And so now I want to turn to the team. I know there's a couple of you in the room with me, a couple of you online. If there's anything going on in your sectors you want to announce, Sharon, you want to say anything about the rebrand or anything?
No, I just look forward to seeing everybody on the 22nd for that open house. New name, new logo, new colors, new everything. Well, not everything, because we're going to keep the good stuff that we already are doing. And we're going to add on to that where we've got some stronger partnerships, just some wonderful things that are happening for Health Visions and in return for the community at large. So looking forward to seeing everybody on the 22nd.
Awesome.
Oh, I also want to do a save the date for our annual breakfast fundraiser. That will be September 25th. I hope I got the right date. Laura is nodding her head. That is Friday, September 25th at 8 a.m. Mark your calendars now. It's going to be a time to remember as well. That's it for me.
All right. So that is all Health Visions, our last Health Visions update. You know, we gonna rock it to that new name. So this is our last Health Visions update. But we want to hear from you all. You know, you all are working in different sectors and have amazing things going on. So please, this is your time. Come off mute. Let us know what's happening. Share with us.
I'll share real quick. I had a good conversation with Cassius lately, and I'm excited that things are moving along for the Language Access Lab. Still a staff of one, so lots of volunteers, but the Language Access Lab has softly launched the first regional interpreter roster. We're trying to create a community, and you can find it on our website, which I'll put in the chat. But we're trying to create a list of trained interpreters so that when you and your organizations at a last minute don't have a contract or have a last minute need, you can contact them. We will not be paid for that. It's totally free to use, and we're excited about it. And also I told Cassius that I would love for Health Visions to have a table on April 18, and you all are invited as well. We're going to have we are having a series of community events that connect bilingual professionals to employers. So on April 18, we're literally having some activities for our interpreters to connect with local employers who value language skills. So if you're interested in that, again, I'll put my information on the chat. But we're trying to create more of a community-wide awareness around how important it is to have language access across sectors. So with that, thank you.
I'll do a quick plug. So I am going to be holding the next prenatal and infant care network luncheon, and I want to do it around fathers and services for fathers. So if anybody knows an agency that we can highlight and come get to speak at that luncheon, I have a couple in mind, but it'd be greatly appreciated just so we can share the resources for our dads. I'm going to put my email in the chat. I think most of you guys have it, but just in case.
All right, I can go next. This is Jamie Yates from Bowen Health, Director of Community Engagement. I just wanted to share some updates regarding some committees that I sit on, as well as access. And apologies, I am driving, so that's why my camera's not on. But first update is I am with the Allen County PCA, which stands for Prevent Child Abuse. If you aren't aware, April is Child Abuse Prevention Awareness Month, and we are doing a lot of things in partnership with some community organizations such as the Allen County Public Library, as well as some businesses that are outlining the courthouse downtown. But we are having a proclamation on April the 10th at the Allen County Courthouse right out in the front lawn. We invite anybody to attend. We'll have a proclamation from the mayor. I don't I haven't confirmed that she'll be in attendance yet, but we will have some speakers from various organizations who are there to talk about child abuse prevention and awareness. So come one, come all. You all are invited. It's 11:30 a.m. at the courthouse on Friday, April 10th. I will also send a flyer out for that if you can get it to everyone, Cassius. And my next update is regarding the Indiana Mental Health Summit. That is on Tuesday, May 19th at the War Memorial Coliseum. Registration is open. Keynote speaker is Zach Williams, the son of the late Robin Williams. And we are going to have some amazing panelists and breakout speakers as well that are local and statewide. So please register for that. It's going to be amazing. Also, please share with the clients and patients that you work with, because we are hoping to get more community members engaged. If the dollar amount for the ticket is a barrier, you can always reach out to me and we will work with the individual organization on that price. We do have some scholarships available. So we don't want finances to be a barrier to attending this, because there's going to be a lot of great collaboration and information shared. So again, that is Tuesday, May 19th at the War Memorial Coliseum, and it's an all-day event. And then I'll also send a flyer out for that. And then, and I know Alice Jordan, she is over the sponsorship. She is still looking for sponsors for that event, I believe through March 31st. So if you're interested, you can let me know and I can connect you with Alice. And then finally, just a quick note of access for our 3 locations in Allen County and our opioid treatment center. So I just looked at access at the beginning of the week. We are able to get same week new patient appointments for both primary care and psychiatric services. So we just welcomed a new member on our psychiatric team. Her name is Lakeisha. She works out of our Washington Center Road location. She is taking traditional Medicaid only right now. However, she is working on being paneled with all different insurances. So right now she's accepting new patients with traditional Medicaid, and I'll let you know when she's available to take all. But we do have same week appointments available at our Rudisa location as well. And then therapy is about 1 to 2 weeks out, but in some locations we can get you in 6 weeks. So I think that's it for me. Thank you for your time.
All right. Is there anyone else who wanted to share real quick what they, yes, Colleen?
I have a few updates. One is that I put it in the chat that the Black Youth Suicide Project is launching phase 2. So some of you may or may not know that, and actually I presented to this group on this before, that 1 in 4 Black youth in high school in Indiana report having thoughts of suicide in the last year, 1 or even more times. So there is a project called the Black Youth Suicide Project. However, the youth that went through phase 1 call themselves BLISS, Team BLISS, and BLISS stands for Black Lives Inspiring Suicide Solutions. And phase 2 is starting with that. There is a research grant alongside it. So the youth actually get paid to participate in their own research project. They design it, they implement it. It's totally youth-led, and they are recruiting youth that identify as Black or Afro-Latino in Allen County. And so I put the Facebook post. You guys can check it out. For some reason, I can't attach flyers right now on my computer. So that's one thing. The Alternatives to Suicide support group, which is for people who are feeling overwhelmed, feeling hopeless, having thoughts of suicide, any of those situations. It's a safe space to just talk about how you're feeling rather than being forced into treatment. It's not clinical. It's just peers getting together and talking and supporting each other. And it's moved to Thursdays at 5:30. I'm going to put that in the chat, and I'll get the flyer, Cassius, to you for that as well. And then lastly, the Action Over Silence project has free training on conversations on access to lethal means. What it is a 2-hour training that reviews kind of warning signs and how to ask about suicide, but it also spends a good chunk of time on how do we have conversations about whether there's firearms in the home or extra medication that could be used to end their life, and how do you make that a collaborative, respectful conversation rather than saying, we got to take your guns, we got to take your meds, which can feel really disempowering and shut people down and they won't work with you anymore. So how do we have those collaborative, respectful conversations around safety in the home when you have someone in a mental health crisis? And we're offering those weekly for free over at Connect Allen County, and I will get you the flyer. We're going to change some of those to virtual because I know some folks don't have the time or can't travel. So I'll also we'll be updating that as well. But thank you for letting me talk.
Colleen, I have a quick question on alternatives to suicide group.
Yes.
Do you welcome interpreters in that group?
Oh, that's a great question. I can't see why not, but I will definitely ask. And we want this to be accessible in any way, shape, or form. So I highly doubt the answer is no to that question, but I want to double check. Great question, Jamie. I'll let you know.
Thank you.
Sure.
All right. Everyone who shared, we appreciate hearing those updates, making sure everyone is in the know of what's happening. We are better together in community, connecting health. We want to be sure to give you back your time for today. And so we thank you all for joining. We will be sending out that email with those dates, noting everything that we have going on. We're excited again. We're signing off for this A-Check as Health Visions, and we see you next month with our new name. So thank you so much, all who joined. We'll see you later.